Good morning and welcome back to another episode of Coach Corner, and this is the continued discussion of the Scary Mommy blog. I'm going to go through this point by point. The next session, if you're interested, will be a discussion of the actual effects of the law and what those effects will be on humans, on mothers, on doctors, things like that. Okay. Anyways, I want to start with this. I may have to separate this into two parts, so I'm going to go as fast as I can, okay? This is a sad story to read about the Mahafis. There's no denying that. This actually happened to my wife and I, our first pregnancy, after our son was a miscarriage at pretty far along in the pregnancy. And if you wanted to discuss that privately, I would be willing to do that. I've talked to my wife about that, and I am willing to have that conversation about those details, as tough as they are. I realize this is a tough subject. I want to go down in order of how the blog goes, how it's written, okay? The first paragraph, but because of a horrific law that has no basis but to torture and shame pregnant women. That's not correct. If you look at the wording of the law, and it does have flaws, I'm going to get to that. The purpose of the law is not at all to torture anybody, not mother, not infant. The purpose, the intention of the law, and I realize good intentions don't always produce the results that laws are intended to when they have those good intentions. But the intention of the law is to make sure that doctors and parents are waiting to the last possible minute to do everything that they can to make sure that the baby does survive. Okay, the goal of the law is to promote a longer gestation period that can lead to a more viable fetus if procedures have to occur earlier in the pregnancy than is anticipated or wanted. So the goals is centered around trying our best to preserve and bring about to propagate life. That's not a torturous idea, okay? And the second part of that is something that's frequently referred to in arguments about this, about shaming women. I think this is an incorrect view on the issue. From my perspective, I realize I'm an individual and other people have their own opinions. From my perspective, it's not the woman that should be shamed. A woman is going to feel some pain and suffering. That's another point about this article that I'd like to touch on. But the person that should be shamed in this endeavor is actually the doctor. Okay, for decades now, society as a whole, the masses have been conditioned to accept this as a normal, civilized function of our species. So I don't blame society, I don't blame the average citizen at all, and that's not who should be guilted or shamed. Doctors go through years of practice and medicinal experience, especially surgeons, and they know exactly what's going on here to the greatest, to the most finite detail. They know what is occurring when they inject or remove a fetus to stop its heartbeat. Okay, the doctor holds the blame, not the mother, not society at large. Okay, so we should move past that. I'd like to then skip down a couple paragraphs, but before I do, I mentioned an important facet of this article is that it talks about the pain and sadness and emotions involved in this, and it's right to do so. It's right to highlight those features of our species, because it should be a difficult, painful, emotional experience to lose an infant, be it in the womb or out. Okay? It's an innocent, vulnerable human life, and when you lose that, those emotions should be expected. It shouldn't be a callous removal of an object, of a tumor. So it is important that this article hits on that. Okay? But a couple paragraphs down, let me see right here, third paragraph. Frankly inhumane and cruel women's health laws, this wasn't an option, and he still had a heartbeat, which we were forced to listen to. Because the fetus had a heartbeat and was 20 weeks along, the attempt to induce labor was prohibited by HB2 Texas law, which is discussed in the subsequent paragraph. Okay, that's the part of the law that I would like to address right here as being incorrect in its intentions. Okay, this is a prohibition of a doctor trying to alleviate the pain and suffering that we already know scientifically is going to occur. A prohibition of inducing this is not the upright way to go about this. I understand the intention of the law, but the first patient is the mother, okay? And if we know scientifically that this baby is not going to survive at this point in gestation, then there are medical alleviations. We need to alleviate the doctors from the how to say this without sounding callous. Doctors need to be able to perform the things they need to perform on their patients when the situations occur. Okay, prohibiting those things by law is not a what I would consider a pro-life position. The first life that exists on this earth is the one that should be taken care of first, and that's the mother. Okay, that doesn't mean that we should just open up society to choosing abortion, and I'll get to the late stage abortion versus 12 weeks or whatever in just a bit. I'm going to pause right here because I'm not sure how far along time-wise I am, and I'm going to be cut off by my camera at some point. I'll continue the discussion in just a moment, okay? Thank you.